So I think there's a number of concerns that we need to talk about in terms of taking telehealth and remote patient monitoring to a large scale. First is the simplicity for the users. Right now, teaching someone how to put on a blood pressure cuff by itself is difficult, especially for an older person. So we're working on ways to make the monitoring devices much simpler. Wearables, you're hearing about wearable sensors. That's going to make more and more sense because something that you wear that's part of your clothing or a wearable sticker, all those things are going to lend themselves to greater simplicity. And the simpler something is, we talk about it being frictionless. That's another tech term. I think for most people, it just needs to be magical. It needs to be something that for even an older person or someone who's sick, it doesn't require them to even know that they're being monitored. And as simple as, at the most, plugging something into the wall, and then it automatically talks to sensors and wearables. And then obviously the price, the cost of these devices. If they're so expensive, then we can't afford for everyone to have one of these devices. So I think the good news is technology is creating simpler devices, and as we're opening a bigger market to these device opportunities, the price is coming down. To getting the doctors and nurses to use these tools and to practice medicine in a very new way. So that's a little bit of behavior change and training and retraining, and really starting to understand how to take better care of patients without having to see them in person, face to face, and that's going to take time to change the way we practice medicine. Hospitals without beds. Now, that's almost nonsensical, isn't it? But yet, this is now happening in many places. And it begins with, in many circumstances, a need, because we're having a shortage of doctors and nurses who are trained in intensive care unit patients. So now we've learned that doctors and nurses can monitor patients very far away in intensive care units and do that safely and actually improve care, because now you can afford to have a highly experienced doctor or nurse in this central location and be able to see the data from patients 1,000 miles away. And so the learning that took place in seeing that can be safe and very, what we call, cost effective and better outcomes was very encouraging. And now these hospitals are building more facilities to have patient care, but in the home or in other places, and it's very important. This is a big step forward in how we can deliver better care to more people at a lower cost. And unfortunately, healthcare is very it's very slow to change, and it's slow to adopt new ideas because healthcare is based on something that is safe and proven. And if something is new, it's usually not proven because it's new. And so if something's not proven, then there's concern about, well, is that safe? And so you have to be able to take technology ideas and show very quickly how they're just as safe or even potentially more safe than what we did in the past. And then you kind of open more doors to new ideas.